Hi, I'm Brian Poole. I'm an associate professor at Brigham Young University. My PhD was in immunology and virology. So I've been studying viruses and how they affect the immune system for going on probably 20 years now. I've been at BYU since 2008, and I've recently been working quite a bit on vaccine hesitancy and beliefs about vaccines and how we can, communicate the realities of vaccination better. Right. So the reason why you use the 7-day rolling average is because days are different. Fewer people are going to go in to be tested on a Sunday. There are fewer locations open on Sundays, for example. It may take a couple of days for places that do tests to run the tests and then report the data. And so generally what we see is like there's a big spike in cases on Tuesdays and then it goes down, and certain days are higher than others because of factors like that. People don't do the same thing every day during the week. So the best way to see how many cases there actually are is not to look at any one given day, it's to look at the average over a 7-day period, because then that incorporates every day during the week. When we're talking about COVID statistics, they follow each other, right? So infection is first. The first thing you'd see would be like a positive test. And so your tests might go up, but then people would say, oh, the tests are going up, but the hospitalizations are staying down. We don't need to worry about it, right? But that's because it takes a week or so from getting infected to needing hospitalization, right? And so then the hospitalizations start going up. So they have this testing as like a first indicator, and then hospitalizations are a lagging indicator. And then once the hospitalizations go up, then people say, oh, yeah, the hospitalizations are up, but the death rate is still low. The deaths aren't up. That's because deaths lag behind hospitalizations. So that's another 3 weeks out, right? So now, even though we're seeing, decreased cases and we're getting closer back down to where we were in the summertime, it's still been like since September that we haven't had anybody die of COVID. We're still having numerous, COVID deaths every single day. And so it's just important not just to look, I think, at one number, but to look at all three of those and see how they relate to each other. Increased cases will lead to increased hospitalizations, which will lead to increased deaths, but you can't just take a snapshot of one day and say that that's everything. You have to look, into the future basically to say, okay, our case rate is going up. That means in the future, the death rate is going to go up. It doesn't mean that today the death rate will go. A lot of people will say oh, people didn't actually die from COVID, they died from something else, right? They had, the death certificate lists COVID, but it also lists something else. And for Utah, they actually go through and examine every single death due to COVID, and they make sure that the death was due to COVID, despite any other, comorbidities that people have going on. These people that are dying from COVID are not people who would have died anyway. They're people who would still be living today had they not caught COVID. And so saying that, somebody, they didn't die from COVID, they died from diabetes because diabetes was also listed on the thing as a contributing factor is really disingenuous, and I think a very bad faith argument. They would still be alive if it were not for the COVID. COVID killed them. It's horrible. It's much worse than I thought it was going to be. I think if you look at I did a video when it first started, when we were closing school down, and I was making kind of a worst case estimate. And I was like, well, if this stuff holds and we don't do anything, then 300,000 Americans are going to die from this. This is really serious. 300,000 Americans are going to die. And now we're, 510,000 Americans have died. And so it's worse than I thought it would be. Yeah, so it's not great. Right. So in places that have had success with vaccination programs, especially Israel, and the United Kingdom is starting to show this now, but Israel was first because they vaccinated a lot of their at-risk population very early. They're up to about 50% vaccinated. What they're seeing is the death rate is dropping dramatically among the vaccinated people, and the infection rate is actually dropping dramatically among the vaccinated group. They didn't really look at vaccinated versus unvaccinated, but they looked at like the over 70s who were the first people to get the vaccine compared to the younger people. And traditionally those two had kind of moved together, but now the people who were older are actually getting less disease than the people who are younger because they're all vaccinated. So those lines are starting to diverge. So that's real world evidence that the vaccine is actually working. Nobody who has gotten the vaccine properly and has given it the right time frame has actually died from COVID, and millions of people have gotten the vaccine. I think more people in Utah have gotten the vaccine than have tested positive for COVID, with 0 deaths from COVID in vaccinated people. So it's a game changer. It's a tremendous accomplishment. All 3 of the approved vaccines will prevent death and hospitalization. So they're all very effective. My guesses are that the virus will not go away completely. There are just too many people who are not willing to be vaccinated for that to happen. But I think it will become something that once the most vulnerable are vaccinated, once most people are vaccinated, it's not going to be killing people anymore. And so it's going to be less of a concern, and we're going to be able to go back and do those things, get back to normal, and COVID will be around. It will still be a thing. People may still die from it occasionally, but it's not going to be the huge numbers that we have now and the huge society altering disease that we have now, because most people will be immune. A lot of difference is being made, like between a lot of kind of hay is being made out of the difference between those vaccines and like the Johnson & Johnson vaccine, where they're or like 95%, the Johnson & Johnson vaccine is still like 85%-ish effective at preventing infection, which is really good, right? I mean, these are all good vaccines. They all pass the test. The test for a successful vaccine is that it prevents like at least 50% of people from getting it. That's a successful vaccine. So these are all highly successful vaccines. They all work. And even with the Johnson & Johnson vaccine, you are able to, it prevents severe infection. You don't die from it. You don't go to the hospital from it. So you can still maybe catch it and test positive occasionally, right? This is rare. Most people who get vaccinated will not catch it. They will be protected. But occasionally, maybe you can catch it, but it's not going to kill you at this point. So people kind of what I'm seeing mostly is, whatever vaccine you're offered, take that one, because it's a lot better than not being vaccinated at all. And they're all good vaccines. Hopefully by the end of May, which is what President Biden said, everybody will have a chance. You guys will have a chance to do that. And I know that they're actually focusing on colleges. I've had discussions at BYU. We're talking about setting up like clinics and things like that to try to make it easier for BYU students to get vaccinated, because even though you're young, you're all kind of clumped together, and so that's viruses really like people being clumped together. So college students are a focus of health policy. So I would imagine that they'll be available to you fairly shortly. So the best thing we can do right now is to not give up yet. Everybody is saying, oh, the numbers are going down. Everybody's tired of it. Everybody wants to get back to normal. The vaccine is out. Everything's looking good. The horizon is great, right? I see an end to this very soon, but we can't give up yet. Right now, the numbers are going down, but COVID is still very prevalent in the community. And so people still need to take it seriously. You got to keep wearing your masks. You got to keep social distancing, for a month and a half. By the end of the month, we'll probably all have had this month or next month, we'll probably all have had an opportunity to be vaccinated. We'll be immune. That'll be great. But, you don't want to get it before that. So, or give it to somebody before that, especially, with your age group. It's generally more a danger of giving it to other people who would get really, really sick than, even catching it yourself. Although you can get very sick. My son is your age and he got very sick and he was out for like 2 weeks with this disease. It's not something to mess around with. But yeah, just keep doing the things that they've said to do. Wear your mask, wear it over your nose. Don't make me yell at you in Harmons like I've yelled at 2 people in Harmons because they've all got their noses hanging out of their masks. You know how to wear a mask. Just put it over your nose. It really does work. It helps from, if you have it and you don't know it, you won't spread it to somebody else if you're wearing a mask. Just be courteous, right? It's just a nice thing to do, not going around infecting other people with diseases. So just stick to the guidelines that we've been given. I know that, like restrictions have been lifted. Don't act as though restrictions have been lifted until you know that you're safe and you're not going to give it to anybody else because you've been vaccinated for a week or so.